Hello, hi, good evening, friends. I am Dr. Sugeeta. I'm a nutritionist and a health educator and a Ayurvedic specialist. So today we are going to discuss about the topic that is eating disorders. This is the topic which is least talked about. So whenever we discuss about eating, the first thing which comes to our mind is food. Food is a fundamental of our life. Our life revolves around food. We all know this. We socialize around food. We communicate around food. Everything, our happiness is all included with the food. Most of the things are all included with the food. If we are happy, we go out, have eating outs. If we are sad, sometimes we also resort to eating foods. But are you aware there are few people, or we can say there are many people who can't eat food, or those who have adverse reactions to food? You think what I am talking about? I'm talking about eating disorders. Yes, these are the people which cannot bear the sight of having food. So we are going to discuss about food today. So whenever we talk about eating disorders, what the first thing comes to our mind? Most of the people would believe it is a psychological problem. Some would say, I'm sure, would say it is a social disorder. But few people know that there is a biological aspect to this problem. There are researches going on and the studies are there which prove it's not just a psychological or a social illness, it's a biological disorder. Now, there are various studies, fMRI, there are studies which are the techniques which can tell us that there is a flow of oxygen to the brain whenever we get food. So in such patients, or we can say in such persons, the flow to the brain is reduced and they cannot enjoy the food as we normal people do. So whenever we eat food, we get happiness, but such people cannot get such kind of happiness. So we will be discussing about the eating disorders in detail today. So let's get started with our PPT. So agendas of our discussion today is going to be, first agenda would be eating disorders, its definitions, types of disorders. Second would be the treatments. Third would be coping with the disorders. And we'll be taking up the Ayurvedic viewpoint also. And then we'll be concluding about our discussion. So what is an eating disorder? Eating disorders are a serious type of mental disorders. They are characteristic by severe disturbance of the eating behaviors and related thoughts and disturbed behaviors. Typically, people with the emotional disturbances or eating disorders develop an unhealthy preoccupation with food and body size, weight, or shape. So society today promotes the ideals of a slim body. People are often running after models, and they take them as their role models. And they are usually the people who are picturizing that the thinness or the beauty lies when you are like some kind of a weight which is perfect. And this kind of a weight is usually perfect when they are usually underweight. They look perfect on the televisions and magazines. In order to look good, they're practicing abnormal patterns of eating. So why should we be talking about eating disorders? Eating disorders involve self-starvation or overeating. There are different types of eating disorders. We'll be going through those disorders. The body is usually deprived of essential nutrients when person is starving or overeating. So these are needed to function normally. So whenever there is decreased amount of nutrients, the body slows down its processes to conserve energy and the nutrients. This slowing down can have severe medical consequences. The prevalence of eating disorders are on increasing spree in India. In India, it has, you would be surprised to see that it has a high mortality rate among the mental health disorders. There are studies that most of the people who have mental health, they die because of these eating disorders. What plays the largest role in eating disorders? So one of the strongest risk factors for an eating disorder is perfectionist, especially a type of perfectionism called self-oriented perfectionism, which involves setting unrealistically high expectations of oneself. People, they have high expectations from themselves. They really want to become very thin, very beautiful. They have some role models. They want to look like them. On body image dissatisfaction is there. Yeah, body image encompasses how you feel about you and your body. So psychology of disordered eating. So we'll be discussing what is the psychology behind this disordered eating. Eating disorders involve disturbance in eating behaviors. People with disordered eating may have an unrealistic body image. They judge their worth by their distorted perception of the body or shape. They don't feel good in their body. They feel that typical kind of a body is definitely good, and they have trouble seeing the positive qualities the others see in them. If you go and tell them that you look good in this, they'll never feel good. Restrictive eating. This is kind of a mechanism when a person is having such kind of disorders. So they restrict their eating. Restriction of food can also be an attempt basically to gain control over the aspects of self. Usually people, they don't have control over some things which are going around their self, maybe some conditions they are not able to cope up with. So in such conditions, just to feel that they have control over the situations, they restrict their food, so that this is the only thing which they can restrict, and they go with this thing ki they want to restrict their food, and that becomes their part of daily habits, and eventually it becomes a very rigid habit, and it becomes ritual, and then they are not able to basically come out of the situation, and then eventually the eating disorders, they develop into the disease. Sometimes mental abuses also lead to the eating disorders. The emotional abuse and the children who are susceptible to eating disorders, they usually show dysfunctional behavior. Children who are emotionally abused are also more likely to develop eating disorders later in their life. And some people who develop, who experience physical or sexual abuse are also prone to eating disorders. And sometimes, do you know, these people, they are usually not aware of the problem. There are different types of disorders. Some people, they acknowledge their problem. Others, they are not even aware of their problem. Anorexia nervosa is usually one kind of a problem which is usually not diagnosed, because the people with this kind of disorders don't even know that they are experiencing it. So they don't even ask for help. What impact they have on their mind? Parts of the brain sometimes undergo structural changes. I'm putting stress on this word, structural changes. That's why we discussed in the beginning that these are the biological disorders also. And they show abnormal activity during anorexic states. That is there when there is no oxygen to the brain. These changes happen in your brain, and then they are usually permanent. Reduced heart rate also happens, which deprives them of the oxygen. Nerve-related conditions, including seizures, disordered thinking, and numbness, or odd nerve sensations in the hands or feet can be felt by these kind of persons. So now we are going to discuss about these disorders. Definitely, we'll be going into all the details. So there are three types of disorders, broadly categorized, medically defined, which medically these are described about in the medicine books, and some are non-medically defined, and others are also prevalent. So we'll be discussing about these. First is anorexia nervosa. Second is bulimia nervosa. The third is binge eating disorder, and some others also, which are not specified. What is anorexia nervosa? Anorexia nervosa, as the name defines, the person is very nervous. It happens when one is obsessed with becoming thin, that they reach extreme measures. They develop extreme measures to fight the weight. So this leads to extreme weight loss. There is a very a kind of a biological problem with these people. These people, they don't have their hunger center, that is the insula, which is in the brain, is usually not stimulated. So they don't get to they don't get to know that what is the taste of the food. They might feel it's just like a simple cardboard. They don't even get to know about the degree of hunger. Whenever we see food or we eat food, we feel our appetite, our appetite center gets stimulated. But in these people, that doesn't get stimulated. So they don't feel. Whenever they see food, anorexics, they feel high anxiety. There is a lot of disturbances in their mind. And sometimes they feel there is a lot of noise that's going on in their mind. So anorexic people usually cannot focus on the work or the project or the job they are going to do. So the only mechanism which they can fight with this kind of issues which is going on in their mind is by not eating food. So whenever they don't eat food, this noise comes down. So that is the problem which creates this kind of behavior, and the person usually gets a lot of weight loss. So there are warning signs which the family must start noticing. These are dramatic weight loss. In such people, they lose a lot of weight. Sometimes they refuse to eat certain foods or food categories. They can say that this is not the food which they want to eat. Sometimes they give excuses to avoid situations involving food. If you ask them to go out with your peer group, they would usually say they don't wish to go. So they might give you the excuses. Sometimes they revert to excessive and rigid exercising routine. Sometimes withdrawal from usual friends and relatives might also happen. So these are the signs and symptoms. We must be open, or we must be vigilant to see if there is some friend or some relative or some person in the family who is experiencing these problems, so that we should be there to help the person. So what are the characteristics of a patient with the AN? They usually show OCD behavior. They show obsessive behavior. They are very particular about one thing. They keep on doing the same thing again and again. They might have personality disorders. These people are usually introvert people. They don't want to share their feelings. So they usually don't have a big group of friends. They are usually rigid people. So these are the persons who have anorexia nervosa. So when the person is not eating proper food, not eating according to the body, not eating according to their height, so definitely the person is going to develop some health risk. So these are the health risks which are associated with anorexia. The persons, first of all, the mostly persons, they will develop low energy levels. They'll be having lethargy. So with increased or the prolonged behavior, so they might develop heart issues, heart failure, weak hearts. Sometimes they develop kidney failures also. They have low protein stores. Digestive problems can also happen. Usually they have low BP. They don't have good proteins in their body, so they have brittle hairs, brittle nails. They don't have fat in them, so they develop hypothermia. They feel cold very often, lethargy. As already discussed, lethargy would be there. Osteoporosis, that is, the bones, they become weak. So they, since they are lacking on calcium and other vitamins and their other minerals, so they developed osteoporosis also. Sometimes these people resort to substance abuse also. So they can be some addiction to some kind of a drugs or some medicines. They usually have antisocial personalities also. So now, coming on to the next problem, that is bulimia nervosa. It's a different and it is opposite to anorexia. In this, person is overeating. It's an eating disorder in which one starts to consume large amounts of food at once. He would hog down a lot of food, and then he will feel in his mind that this is not good. What he has done is not good. So might try to get rid of these calories. So he might use the laxatives or the purgatives, or he can vomit also, induce self-vomiting also, and they can do a lot of rigorous exercise so as to cut down those calories which they have consumed. Again, the warning signs which the family must start noticing, and there are a lot of wrappers or packets indicating that there is a consumption of large amount of foods. You can find them hidden in their wardrobes or somewhere in their bags. These kind of the things can be noticed by the family. They usually resort to frequent trip to washrooms after meals. There are signs of vomiting. Excessive and rigid exercise routine is also there. So they also withdraw from usual friends and relatives because they might feel that friends usually will tell that you are eating excessively. They usually eat when they are alone. So they don't want to sit with a lot of people or their friends. They resort to uh, sitting in the solo, and then they exhibit this kind of behaviors. So now there are health risks with this kind of eating behaviors, dental problems. As these persons are vomiting often, so there is a erosion of the upper layer or the enamel of the teeth. Sometimes they eat so much and stuff themselves that they might resort to stomach rupture also. The females can get menstrual irregularities. Of course, this happens in anorexia also. The third disorder we're going to discuss today is binge eating disorder. So binge eating disorder, it is usually experienced by most of the people. Most of us sometimes or one time or the other usually resort to binge eating. If we are happy, sometimes we feel like eating something. Sometimes we are sad. Even then we take out some kind of a nice food or chocolates to munch on, to binge on. So this is an eating disorder. It's an eating disorder in which someone eats a lot of food at a time, but they don't vomit. So there is a difference between binge eating and bulimia. In bulimia, people vomit and take out the food. They try to take out the calories which they have consumed. But in binge eating, they don't vomit. They are happy with whatever they are eating. So these kind of people usually are party persons. And warning signs again would be a lot of empty wrappers or packets indicating consumption of large amount of foods. Usually they are overweight. Bulimic and anorexic people, they are not overweight. Usually they are underweight anorexics, and the bulimics, they are usually of the average or the normal weight. So these people are usually overweight for their age and height. They have a long history of repeated efforts to diet, and usually their failures at diet. They cannot sustain the diet for very long period. So they are desperate about losing their weight, but they usually don't have control over the food intake. So they may eat throughout the day with no planned meal times. They just keep on munching everything. So health risk with binge eating. So since these people are eating a lot of junk food, lot of foods, so they are overweight. So all the problems associated with obesity are related with binge eating. they develop obesity and then high BP, high cholesterol, diabetes, heart diseases, and they're also prone to certain kinds of cancers. So now we all are wondering, why do people develop eating disorders? Why can whenever we see such kind of a person, and we see and we think, why he can't stop eating? Why is so he doesn't know that he is fat? Why is not eating? Why is not stop eating? And if a person is anorexic, we would say it's the food is so tasty. Why he can't eat food? So so there are different reasons for people to develop the eating disorders. So usually they are unhealthy coping mechanisms. Factors which we consider are a reason behind this eating disorders are psychological factors, interpersonal factors, social factors, or the cultural factors. And of course, we have already discussed a few things about the biological factors. Psychological factors. The people usually have low self-esteem. They are not very confident of their body. So they are underconfident. They have inferiority complexes. So they resort to such kind of eating. Feeling of failures, feeling of out of control. If they don't have things in their control, they try to control at least whatever little they can do. That is their food. Response to change. Some people sometimes they kids, usually these kind of problems start in the early adolescent age or the early adulthood. So some kids, they are not they don't take it easily about the body changes. So sometimes they respond to eating disorders also. There sometimes it's response to stress also, and sometimes if there is some profound illness, and even then they resort to eating disorders. So now coming out to the interpersonal factors, the factors which are usually one of the major causes of the eating disorders: troubled family and personal relationships, difficulty in expressing emotions and feelings. If a person is not at all extrovert, doesn't express his emotions or sadness or happiness, might resort to such kind of disorders. History of being teased or ridiculed based on the size or weight. So this is one of the features, okay, which we must take into account. And it is very important for the parents to take care. That should not be they should not be ridiculing their kids on their size or the weight. History of physical or sexual abuse is also there sometimes. Social and cultural factors. You all are aware that our culture pressurizes us so much that it glorifies the thinness, and it places value of obtaining the perfect body. Everybody wants to have a perfect figure. Now, the definitions of beauty have narrowed down. Only specific body height and weight is considered beautiful. Cultural norms that value people on the basis of physical appearance and not inner qualities and strengths is also one of the major factors contributing to eating disorders. Biological factors. Eating disorders usually run in the families. There are genetic traits usually which are found in the families, and genetic component is also there. Researches about the brain and brain and its connect with the food is taking place. Certain chemicals in the brain control hunger, appetite, and digestion. If they are unbalanced, the people develop this kind of disorders. There are now fMRI techniques. This is a technique in which there's a 3D vision, and we see the flow of oxygen to the brain is there. And then we see that there are certain areas which are usually deprived of oxygen. So they don't get stimulated when they are given food. Genetic traits are usually, these are the traits which are fixed, but they cannot be removed. But definitely there are various techniques. So we can make them productive instead of being destructive. Low dopamine levels are also one of the factors people resort to eating. If the levels are lower, the usually hunger is also on the lower side. These are the non-medically recognized disorders. Usually they are rare, but they are definitely prevalent. Compulsive overeating, diabulimia, orthorexia nervosa, drunkorexia, pregorexia. So we will be discussing about these in our next slides. Compulsive overeating. This is a compulsion to eat. People who are chronically overeating may have a common eating disorder called compulsive overeating. This is marked by eating large amount of foods, eating quickly, often to the point of discomfort. They don't know how and when to stop. Diabulimia, this is a problem which is usually faced by the persons who have type 1 diabetes. This is a kind of a situation in which the person skips the dose of the insulin, which is needed for the body to metabolize the sugar. So in case they want to lose weight, so they skip their dose, so the sugar is not utilized by the body and it passes in the urine. Orthorexia nervosa. So this is the problem in which the person is obsessed with healthy eating. And I would say these kind of things are usually prevalent more nowadays. So it's because of our exposure to too much of the social media, and the people usually the people on the social media, they get influenced by the influencers that this kind of a food is healthy, whether they are knowing this or not, but they get influenced. So however, this is the attempt to attain optimum health. So the diet may lead to malnourishment, because the people usually, they stop eating some kind of a typical food grain. Sometimes people, I definitely see many people who are going, some people say that we are going gluten free, some people they are saying off sugar, some people they are saying we are off carbs. So this kind of situations, they are under the orthorexia nervosa. So usually they in the long term they are not healthy. So drunkorexia, so it is a term characterizing the replacement of meals with alcohol. While this is kind of this is more prevalent in the college students' cultural beliefs. It glorifies the people who are thin as well as on they drink. They are considered very mod. So nowadays people are, or the college students are, under the peer pressure. Sometimes they give up on their cultural beliefs, and they resort to this drinking habits also. And they start skipping meals because they know they have taken excess calories in the form of alcohol. So they resort to excessive exercising. Sometimes they do purging also. So these kind of the behaviors are also sometimes noticeable. Pregorexia is when someone uses disordered eating to control the amount of weight they gain during pregnancy. Females are very conscious nowadays, so they don't want to gain excessive weight when they are pregnant. This behavior can lead to eating disorder in the later stages. So there is no exact cause of pregorexia like other eating disorders. People and experts believe the various risk factors may add on to the likelihood of developing these conditions. Environmental triggers also play a definite role in this problem. Risk to the child. If the person is not eating properly, it can cause low birth weight to the unborn child, preterm labor, feeding problems, seizures, and possible attention deficit disorders later in the life can develop. Other prevalent eating disorders, food cravings. We all face food cravings, and pica. So food cravings, it's an intense desire to consume a specific kind of a food. So it's usually different from normal hunger. It is not the hunger, it is just to have that typical feeling that they want to have a typical kind of a food only. Usually the males, uh, uh, they are wanting to have, or they crave for proteins or these salty kind of things. The females, they usually resort to sweet or the chocolate kind of things. So there is a list of deficiencies which are caused, which are happening due to these kind of cravings. So sometimes we are deficient in some kind of minerals or nutrients, and then we crave for foods. So if a person is craving for chocolate and cold drinks, might be having the deficiency of magnesium. So the healthiest option which we can choose is nuts, whole grains, legumes, and fruits. And if a person is craving for sweets, might be going low on carbohydrates, phosphorus, or sulfur, can take fresh fruits, fish, eggs, dairy products, legumes, whole grain. For sulfur, they can take cruciferous vegetables. Tea and coffee, if the person is craving for tea and coffee, might be deficient in sodium chloride, and fruits and salads must be the best choice. Iron deficiency might be there if a person is craving for tea and coffee. So iron deficiency can be treated by having a lot of green leafy vegetables, eating meats and the pomegranates, or having or cooking food in the iron utensils. So sometimes persons, they crave only for snacks or fatty foods. These persons are usually deficient in the calcium products. So milk products are a best source of calcium. Dairy products, cheese, paneer, and curd, these can be used as options. Legumes can be sesame seeds, that is tilke seeds, can be included, or the ragi seeds can be included in the diet. So what is pica? Pica is an eating disorder in which non-nutritional objects are often eaten. So they don't have any edible value. They are not usually edible. So these are characteristics by compulsive eating, chewing, or licking. Usually kids usually resort to pica. Children from the age of 2 to 6 years, pregnant women, and mentally deficient people usually resort to pica. Possible causes, sometimes nutritional deficiencies are also there, especially iron and zinc deficiencies cause these kind of problems. Stress, obsessive behavior, developmental disorders, mental disorders are one of the reasons for pica. Effects of pica in children: malnutrition, severe stomach ache. If the child is having often stomach ache, then the parents must check whether he is licking on something, maybe some kind of a stone, soil, or sometimes kids, they also lick the walls of the houses also. So muscle weakness might be there, brain damage can be there. In adults, infertility usually can happen, increased blood pressure, nervous disorders, muscle and joint pains can also occur due to pica. So how do we assess that a person is having this eating disorders? So assessment is usually done by the physical examination. We check the weight, blood pressure, temperature, and hair, heart, lungs. Everything is checked by the doctor. Tooth enamel is also checked for erosions, and the gums are also checked. Nutritional assessment, evaluation is also done by asking the person about their eating habits, their eating patterns. Biochemistry is also done to check whether they are deficient of some kind of minerals and vitamins. And one most important thing, which is very important for the assessment of this disorder, is the interview of the person. So his history of body weight, past body weight, present body weight is compared. History of dieting, whether they have done any diets, or if they are prone to recurrent dietings, eating behaviors, All weight loss related behaviors are also asked about. Past and present stressors are also asked about. Body image perception is also asked. We also ask the person if they are happy with whatever they are, what is their current weight, or whether they feel comfortable with their body or not. Screening for depression, self-esteem, anxiety, appearance, mood behavior, thinking, memory, substance abuse, physical abuse, or sexual abuse is also asked about. Some mental health disorders are also checked if they are prevailing. Some sample questions to ask, we asked that we have already discussed, that whether they are satisfied with the way they look or not. If any positive response is there, we should prompt further investigation. Now coming on to this part of our PPT, that is eating disorders, how they can be treated. So there are three lines of treatment. First is that you have to do prevention, and then there is a medical intervention, and third is the nutritional intervention. So these kind of the tips will be giving to you in the next slides. Treatment. Prevention. First of all, prevention is very important. If the eating disorder is diagnosed in the earlier or the early stage, it can be cured, it can be treated easily. But if it becomes a prolonged thing, the habit becomes a ritual, then it's very difficult for the body or the brain to unwire that problem. So we must develop, first of all, there should be a vigilance about our family. We should be particular about how our kids are eating, how our family is eating. So we must develop a positive attitude towards one's body. We must develop healthier eating and exercising habits. There should be a proper regime, that this is the eating time, this is the workout time, this is the sleeping time. So body likes the system or the discipline. Increasing comfort in expressing feelings. We must talk to each other. This is very important. Everybody, nowadays people, they don't talk to each other. It's they are usually on their phones or YouTube. So this comfort talking is usually lacking these days. So it's very important that we should take out time to talk to our family or our friends. We must develop healthy strategies to deal with the stress. And assertive skills should be there. And sometimes the treatment might need some kind of a medicinal intervention, and sometimes hospitalization or medical methods are also used for treating these kind of disorders. So nutritional intervention is also very important to normalize the relationship with the food, to gain an understanding of the nutrient needs of growth, development, and tissue and weight control should be given to the kids in the early age. So they are very aware that this is important. Introduction to fear foods. If a person is fearful of some kind of foods, they should be gradually and slowly introduced. So adequate vitamin and multivitamin intake should be there. So we have discussed this inpatient and outpatient methods are also there now available sometimes about treating these mental disorders. So restore in the medical treatment, first focus is to restore a healthy weight, treat the physical complications if any are there, enhance the motivation to participate in the program, because in people who are anorexic, they are not aware of their problem, so they don't want to enter in this program, they don't want to fight this disorder. So it's very important to motivate them to get to know their problem and fight the problem. Psycho education about the healthy eating and nutrition is very important. Identify and understand the dysfunctional attitudes. Provision of psychotherapy for emotional disturbance is also very important. The nutritional plan should be like, which should be a balanced diet. It should be rich in the energy, protein, minerals, vitamins, everything should be there. The fats also should be there. So a person, these are the self-help tips which a person must, which all of us must include in our daily life. We should learn healthier ways to cope with the emotional pains, because nowadays, since I am into nutrition and I daily see people that they are usually, if they are stressed or they are some kind of they are feeling low or under some kind of a dark phase, they usually resort to eating food. And this is not a healthier option to cope with the emotional pain. Develop a balanced relationship with the food. Learn to accept and love yourself as you are. So you cannot be you if you are given this kind of a body and shape. This is, I certainly believe this is the creator's best creation. So if he has given you this kind of a beauty, and you must love yourself, and you will definitely start looking more beautiful in your eyes, because beauty lies in the eyes of beholder, as they usually say. And it's very important in this kind of patients, usually they don't feel good when they are eating food. So there, because there is a mechanism in anorexia, they get a lot of noise in their heads. When they eat food, there is a lot of noise. So they resort to not eating food. So when they develop weight or they eat food, so they are not happy. So this kind of thing, so they kind of develop relapses. So they should be avoiding the relapse also by constant vision. This is the very important or very one proverb which I saw somewhere and I liked it so much. The first step to solve the problem is to acknowledge the issue. So we must acknowledge the problem first, then we can definitely solve the problem. In eating disorders or the persons who are having the symptoms, it is very painful and difficult to manage the symptoms. And in such kind of people, the illness becomes, this becomes so comfortable with the illness, they don't want to come out of it. So they resort to this kind of behavior of eating disorders. So it's a bit difficult and challenging task. So tips to stop binge eating: stop restricting yourself, make sure you eat the meals at the proper time, plan out your meals and snacks in advance. You can take out a diary or a note. So plan your meals when you are retiring to the bed for the next day. If you are not if you have planned your things, you won't be in haywire, you won't be haphazard kind of a things, and then you would be able to stick to your diet chart. Recognize the foods. One must recognize foods are not good or bad. They are not usually the culprits. Late night snacking, usually due to hunger or boredom, should be avoided. Zoning out in front of the TV or other form of numbing outs, stressful situations should be taken care by opting for other mechanisms. Take it easy on yourself. Ask yourself if you are feeling deprived. Enjoy healthy meals and snacks. Drink enough water. Identify your patterns and triggers. That's very important. When you identify your triggers and patterns, it's easy for you not to resort to the binge orders or binge eating or the eating when you are bulimic. Learn to let the thoughts pass. They'll come and go. Learn to let them go. Consider mindful eating. Your eating should be, when you are in your senses, always eat consciously. We also say in yoga that you should be breathing consciously also. So here, mindful eating is very important. Move more. That's very important. If you change the pace, if you keep on moving, so this kind of things also, if you take out, if you move from one pace to another, that wiring or the system of eating, that process breaks, and then you can just think that you don't want to eat, or then that is not the only mechanism to cope with the problem. So people usually ask how much time it's going to overcome any eating disorders. So this is kind of a problem. Some people, they usually come out of this problem. Some learn to handle the problem, and some usually take a lot of time to recover from this issue. So it's usually depends upon their person's psychological and emotional well-being. Some people, they take 4 to weeks in the hospital, or sometimes the people usually with their willpower only, they take out a willpower also, they come out of these kind of issues. So recovery from this disorder means letting go of the thoughts and behaviors which you developed at that time, and making peace with the food is very important. Trust your hunger. You should be always trusting your hunger, and you should be having peaceful thoughts or peaceful environment in your scenario or in a vicinity, so that you have proper food. So these are the 5 general rules of recovery. Change your life, get hold of your life. You only can help yourself. Be completely honest with yourself, with your feelings. Practice self-care. Don't bend the rules. If you have given yourself a set rules, don't bend the rules for your from time to time, or from in emotional disturbances. Ask for help. Okay. If you are feeling that relapse is there, ask for help. Don't hesitate to ask for help in eating disorders. It's very important. It's very important in the diseases of mental health that the people should be asking for help. Although there is a lot of stigma related to it, but nowadays, with all this current scenario of people talking about, there are so many people who are doing this kind of mental health awareness programs. So they're also helping these people. So please find the persons or the people or the organizations who are helping such kind of peoples. Family support is very important for coping mechanism. It's the family and the friends who are first to notice the problems. Talking about the problem is very crucial. Understanding that it's not just psychological, but a biological disorder is also very important. Thinking of food as a medicine is very important, because these people, this especially goes for the people who are anorexic. They don't want to eat food. So tell them that this is food is your medicine. As medicines might have effects, but it will have its side effects also. So you have to take food properly at the proper time. Might create problem in persons who are anorexic. There's a very simple tip which I can tell you. If you find someone or there is a person who is anorexic, don't expect them to eat like you. It's very important that they can, whenever they are with you or whenever they are going out, they can carry their meal and eat in front of their friends, which whatever they are carrying, because it's important to eat together as a family. And please don't expect them to eat like you. Pre-planning of the food is very important. Eating is painful for them, but eventually it's going to definitely help. So tell them it is painful, but it is a medicine, so you have to do it. So Ayurvedic view on eating disorders. Ayurveda is 5,000-year-old Paddhati, and it is definitely, it in that time also knew about these kind of disorders. So there are 3 types of people: air people, fire people, and water people. Air people, they usually have Vishamagni, or their digestive power is usually variable. Sometimes they have strong digestion, sometimes they have very weak digestion. Pitta or the fire people, they usually have very good digestive powers. Kapha or the people who are watery or the earth body types, they usually have the lower body type, the lower digestive powers. So usually they usually develop food allergies. Vata usually have allergies to vegetables or high proteins or the legumes. Sometimes they develop sensitivity to gluten also. And Pitta, they usually get disturbed with the fermented foods. And Kapha, they usually get disturbed with the wheat or the gluten or the dairy products. Stress response of a Vata person is usually undereater. The Vata persons usually tend to forget, eat. They don't eat when they are under stress. They usually are prone to anorexia nervosa. And Pitta, they usually are resilient under stress, but unless extreme trauma is there, so they might feel weak at that time. And Kapha is usually a overeater. Weight, Vata are usually underweight people, Pitta are usually overweight, and Kapha are usually the obese kind of people. Common eating disorders, I have already discussed that Vata usually develop anorexia and binge eating disorders, bulimia for the Pitta people, and binge eating for the Kapha people. Vata type, these are the persons, their stress response, we have already done that. So Vata can easily forget to eat food, and it is a stress undereater. And Pitta is usually falling to the preys to tendency to overeat. And Kapha are people who usually don't get this hunger or the appetite, but they are people who eat from their habit. So they are just habitual eaters. So, learnings from our Vedas that we should be sticking to some to sattvic ahar. These kind of foods don't trigger our brain, don't trigger the factors which disturb our brains. So we must include sattvic and the food. These are in our the sattvic food is food which is usually in the natural form. Ashtvid Ahar Aitan, which must resort to 8 types of eating food. Viruddhahar. This is a very unique concept of Ayurveda, that foods should not be incompatible, foods should not be eaten together. Eating according to the genetics, we must be eating according to our body type. That is, Vata must be eating according to its body type, Fire must be eating according to its body type, and Kapha must be eating according to their Kapha body type. Each smart strategies must be included in your diets. Sattvic ahar, we have already discussed that cereals, whole grains, as natural, fresh foods, vegetables. This is the sattvic ahar. Sattvic lifestyle should be used always. Mindful eating should be there. A discipline should be there. Viruddhahar, I have already told you that there are some food groups which are wrongly combined. They must be excluded from your diet. They create toxins in the body. These are the various Viruddhahars. We cannot go in the details because of the shortage of the time. So fundamentals of correct lifestyle according to the genetics for a Kapha people. Kapha people must not be eating too much of cold, heavy, or the foods which are too much of heavy consistency. That is, dairy they should be avoiding. And Pitta should be having foods which are light, which are not very hot, spicy. And Vata, they should be eating foods which are rich in gravies, and they should not be airy foods. They should not be aerated drinks, or they should not be too much of foods which are salads, or dry foods should not be included in the Vata diet. So we must resort to healthy eating, and healthy eating habits also. Avoid eating while working, driving, or arguing, or watching TV. Listen to your body. Are you hungry? Sometimes you may be thirsty also. Stop eating before you are full. So give your body that space to churn all the food. Eat just enough to satisfy your hunger. Ayurveda gives a very beautiful principle that you should fill 1/3 of your stomach with solid, 1/3 with the liquid, and 1/3 should be left empty. It's just like a mixture. In a mixie, you can't take out the food if you have added. So our stomach is like a mixie. In case you want to make a good chutney or a good rasa, you must keep some kind of a gap in the food container. Eat early, eat often, eat healthy, start your day with a healthy breakfast, have time to work off the calories, eat small, don't eat too much. Chew your food, savor every bite, the joy of eating. So eating disorders, so we can conclude that eating disorders are unhealthy diet practices that can easily in of hand and are difficult to break. Eating disorders are serious clinical problems that require professional treatment by the doctors, therapists, and the nutritionist, of course. Mantra. The root cause of the mantra is root cause removal, and natural unpinning of the illness requires a holistic approach. Uh, so this is all about the eating disorders, and there was a lot of information, I'm sure, which is there, and definitely the in such a small span of time, getting this much of information might be creating a lot of questions in your mind. In case you have some questions, you can definitely ask that in share that in your chat box, and um, I'll definitely try to answer the questions. Thank you so much. There is a question that small and frequent meals, is it a recommended as a healthy eating practice? Small and frequent meals, definitely. There are different body types, as we have already discussed. There are air people who need small and frequent meals because they don't have a huge appetite and their air gets imbalanced quickly. So they need to have small and frequent meals. In case a person is a kapha person, that person should not be resorting to to frequent meals because he has a low digestive power. So if he is having lot of frequent meals, he will develop overweight. So it's according to the body type which you should be taking your food. How do we know about our body type? This is the question. Body type of a person can be judged by an Ayurvedic doctor. And there are a few questionnaires, and it can be judged by seeing your physical features. Your psychological aspects can also be seen while the doctor is trying to find out your body type. So that kind of a thing is done with a questionnaire usually. So usually on Google or online, there are many questionnaires available which you can answer and find out your body type. What raw fruits and vegetables are best energy source for a diabetic patient? For a diabetic patient, the fruits like apple, papaya, guava, jamun are usually recommended. And vegetables like gourd family, the bitter gourd is very good for a diabetic person. And purple, the pointed gourd is very good for a diabetic person. Drumsticks are also very good options for a diabetic person. Since you have become intolerant, hi, there's a question a person is asking. He is a lactose intolerant person. What other product he can take? If you are lactose intolerant, it's not necessary that you will be you will be intolerant to curd or the buttermilk also. You can include buttermilk and curd in your diet. You can include soy milk. You can include almond milk or coconut milk in your diet. Just having two proper meals is definitely a good practice. They should be proper, healthy meals. Breakfast should be a very good option as a proper meal, and the dinner should be early, later dinner. It's a good practice. Yes, definitely, it's a good practice because the body gets the time to digest the food. In between, in case you are having some kind of cravings, you can resort to fruits and vegetables or soups. Vegan diet is the sattvic diet or the ahar, which I already discussed. It's definitely a good diet. But the only condition is that it should be rich in all the nutrients. Vegan diet should be rich in, you should make your plate in a balanced way. There should be carbs, there should be fats, and there should be sufficient proteins in your diet. Vegan diet is not a bad option. They are definitely developing various techniques in IIT or for this test to find out your prakriti. But the best and the most trusted thing is that you visit an Ayurvedic doctor or you resort to some kind of a questionnaire, so that can tell you about your body type. The question is how to bring down high triglyceride levels. Uh, High triglycerides level can be brought down by eating a fiber-rich diet. You can include oats in your diet. You can include barley in your diet, and a lot of vegetables should be in your diet. Most importantly, you should be doing some kind of a meditation so that stress is also not there, because one of the factors for high triglycerides nowadays is oxidative stress, and the workout should also be there. These are the few things which you can inculcate in your daily habits to bring down the high triglyceride levels. And definitely there are few herbs which can be included in Ayurveda. Arjun is a very good herb which can be included in your daily regime, but you must ask a doctor before starting any kind of a herb on your own. Thank you so much, all of you, for being so patient and asking so wonderful queries.